Hi everyone. Today we're going to talk a little bit about dental monitoring. To understand dental monitoring fully and appreciate how it can help us, we need to understand a little bit about what our patient want and what they don't want. So what they don't want is compromised results, extended treatment times, too many appointments, and having to work around us. What they do want, quality outcomes in a shorter time frame, less appointments in the office, which is obviously very convenient for them, and also better and quicker access to the doctor on their schedule. And of course, we know all of that actually is particularly important in the post-COVID-19 era. So that's exactly why we use dental monitoring. So what exactly is it? It's essentially a smartphone app which is powered by artificial intelligence, allows the patient to take a series of videos of their teeth from various angles, and allows us and the doctor especially to monitor how they progress. And it leads to the patient benefits that we sort of discussed briefly before. And in my opinion, it really is the future of orthodontics. What can you use it for? Essentially most things. Any active treatment in aligners, braces, carrier, or a expander. You can use it for recalls as well, and you can use it for retention. Obviously, all of those need a different sort of setup, but it is possible. And what does dental monitoring report on? Well, there's actually up to 180 different types of observations, whether it's unseat of a tooth or an aligner, broken brackets, wires that don't actually look like they're active anymore, gingival recession, you name it. It basically covers most of it. So, come to the workflow. So the patient downloads the app, use the app as instructed, uploads the video, artificial intelligence does their analyses, and then sends a report to the practice. The practice and the doctor assesses the report and communicate with the parent and patient as required. So we're going to use clear aligners as an example, and we're going to explain a little bit about their journey. We're also going to talk about how data monitoring can help the practice and the patient in terms of treatment efficiencies. So let's look at a case. So in terms of the steps, start with a exam as well as a scan or impression. After setting up the CleanCheck or equivalent, you place the aligner including any attachments that you have deemed appropriate. You instruct and show the patients how to use the dental monitoring, perform any interproximal reduction you may have planned at the right stages, continue the dental monitoring process, and essentially you bring them in and double check that they are ready to finish. You finish and provide retainers. Now, from the patient's point of view, they will see scan reminders pop up as a notification on their mobile app. It'll remind them that it is time for them to do a scan. They also get a late reminder as well. So if they forget to scan, they will get another few reminders. These can be set according to your preferences, so whether it is a multiple reminders or just a single one, that is entirely up to you. And there can actually be live feedback following each scan. So immediately after the scan, it is uploaded to the portal, and this is where the artificial intelligence kicks in the case where the patient is extremely compliant or the teeth are tracking extremely well, all the notifications have not been set off in terms of there's no recession or unseats, broken brackets, or anything like that. You will get a notification such as this one that you can see on the right hand side. And as you can see, it basically allows the patient to progress and change aligners straight away. They know they're doing really well, and they will be sent another scan reminder at the following week or 2 weeks, whichever you set your scan intervals to be at. The app also provides a chatting function. So this allows the patients to actually message any concerns, queries they have directly to you. And I find this actually is one of those features that the patient love the most because it avoids it for them. They don't have to ring the practice and then wait for you to call them back. So it literally bypasses the receptionist and get direct access to you. From our perspective, it means that we can sort of respond and also respond when we are actually available. And this really, I think, for a lot of my patients, they feel comfortable and they really appreciate how we can actually be there for them every step of the way along their journey. So the app also provides a lot of different statistics for those of you who are interested in. If, for example, it can give you a brief rundown on how many goes and ungoes the patients have had. So essentially a go is when everything looks great and the patient is able to actually proceed to the next set of aligners. And a no-go is when something has come up, whether it's an unseat or two, and you wish the patient to sort of stay in the current aligner before moving on to the next one. So last but not least, it also allows you to sort of morph the images. So it really allows you a before and after progress video, which everyone loves. So let's look at some of the treatment efficiencies I was talking about. This was a tiny study that we did at a sort of early part of the dental monitoring. So before dental monitoring, these aligner patients, they average about 11 appointments. And as you can see, most of them require at least one, if not more, aligner refinements. The average time in treatment was 17 months. Now, after using DM, we found that the number of appointments drastically dropped, as you would expect, because we're seeing them essentially at home now instead of coming in. And so that number has almost dropped in half. And interestingly, the amount of people that require a refinement also dropped a lot. We feel that it's because patients understand that we're checking up on them every week, essentially. And we do have protocols in there to try and encourage them to be really good and really compliant with their aligner wear. So trying to send them a really positive message. And as a result, you can see the number of months in treatment has also dropped quite significantly. So we've dropped almost 5 appointments, almost 50% in terms of refinement rate, and reduced an average of 5 months in treatment. Okay, so we're gonna have a look at a case here. It's not the world's hardest case. It's a reasonably straightforward case, but I think it really illustrates the strength and the power of dental monitoring. So you can see class 1, sort of mild to moderate crowding. And so that's her final records. Total aligners were 60 aligners. She was doing scans at 5-day intervals. Overall, about 11 months. And 4 appointments essentially. So the initial exam and the scan, aligner insert, interproximal reduction, and the finish and retention. This is obviously an ideal case. Not every case is going to turn out like that, but like I was saying before, it really demonstrates the power of dental monitoring and what it can do for not just for you, but also for the patient. So a little bit repetitive now, but hopefully you get the idea. So it's improved quality outcome for the patients, absolutely improving the convenience for them, shorter treatment time, a peace of mind because we're essentially monitoring them, having a look at their progress every single week, improved access to the doctor and the team as well, and it minimizes any unnecessary visits to the clinic, and so it provides additional safety post-COVID-19 era. So we believe dental monitoring is a game changer, and it certainly has been for us. We've been early users of dental monitoring since 2017, and especially during the COVID-19 times, which we're actually still going through, but particularly during the times of the lockdowns, it was a real lifesaver. It allows us to progress treatment further than if we didn't have dental monitoring, and it also allowed the patients to feel a little bit more connected, and they also feel relieved because we were able to monitor their progress. We were able to have a look at anything if they were concerned something was a little bit off. So we felt it really sort of helped us during the lockdowns. So in conclusion, dental monitoring, we believe, is the new standard of care. Every single aligner patients and some brace patients, amongst others within our practice, are on dental monitoring as well. So that pretty much concludes the presentation. I hope you've enjoyed it and found it informative. Please feel free to reach out if you do have any queries. Have a good day.